Deputy Cairns, you have 5 minutes.
Thank you. I suppose the pandemic didn't cause the impact of underinvestment in social and healthcare services by the state, but it did expose it more. And it also showed the incredible resolve and dedication of people with disabilities, their families and volunteers and workers in support organisations. We know this is a particularly challenging time for people with disabilities, additional health complications, the absence of services for months, the erosion of independence and ongoing uncertainty all take their toll. One of the key lessons is that the state must do more to support our disability sector. Through people who have contacted me and conversations with service providers in West Cork, such as COPE and CoAction, it's clear that each story underlines the essential work that is carried out by families, communities and organisations in the area. The state abdicates responsibility for this sector, relying on voluntary organisations and families to provide essential services, and I agree with you all that this has to change. Each of your submissions highlights the challenges for the sector and individuals concerned and provides guidance on disability inclusive recovery. It's that area that I'd like to focus my questions on. Several of the statements refer to Article 19 of the Convention on the Rights of Persons with Disabilities, which guarantees the right to live independently in the community rather than institutions. Mr Egan and Mr O'Connor, you rightly call on the Government to make funding available to the HSE to move the remaining people in congregated settings to homes in the community. Could you briefly outline what would be involved to achieve these?
At the moment, and it depends, we've spoken a little bit about data, and it depends what number you want to look at. The HSE tell us there's in and around 2,000 people in congregated settings, but the guys and the folks there in Hickwood that go out and inspect these places tell us there's about 2,900. So there's a significant amount of people in there. There's a policy been in place for almost 9 years at this place to move people out. Up until this point, it saddens me to say you've had as good a chance of passing away out of a congregated setting than actually been moved out to a community setting. But what we do know, and what comes up in HICWA's annual reports, we've done some research ourselves, the National Disability Authority have done research, is that people's lives improve significantly when they move to smaller community-based settings in line with their own wishes and desires, living lives like all of us around here do, living in their own homes, being supported to do ordinary things like you do in your own home, accessing community services. Their lives improve significantly. And even, when you look at HICWA's annual report from this year, they'd say people lead lives that are not in line with human rights, and that larger residential settings are places where there are issues around protecting people in relation to safeguarding and human rights issues.
Thank you.
If I may. Hi, sorry, just I just wanted to emphasise and to support what Mr O'Connor said, but to point up that the issue of decongregation has been a persistent and ongoing difficulty for the state for decades at this stage, and we haven't solved it. We have allowed, through policy deficits, for this to continue. It's not the pandemic that has caused this, but the pandemic is therefore given rise to greater risks for people who are in these congregated settings. And if I point up just one, in terms of the risks to human rights that continue if we have people in congregated settings. Since March 11th, where you have people in residential settings where they have been essentially shut down and confined to home without access to family, and we might say that's similar for elderly people cocooning, but nevertheless, for these people and for a lot of them, they need access to family as their immediate advocates. That hasn't been there. So the fractures that are in place in terms of the architecture of policy that we now see this pandemic showing up have always been there, but it's clearly within our gift to redress these, to address them and to correct them. And the UNCRPD is the pathway to doing that, and being real about its application and its implementation is what we need.
Thank you. Your collective highlighting of the shocking estimated 1,500 people under the age of 65 living in nursing homes is a subject I've tried to get figures on from the HSE for Cork unsuccessfully, but I think all of us in this chamber need to do whatever we can to end the practice of accommodating under 65s with disabilities in nursing homes. There's multifaceted issues around students with disabilities, which you also raised in your statements, and families are concerned that any individual or collective progress may be lost at schools. as schools and colleges open in the autumn. I'm wondering if Dr McCarthy or Mr Dolan could suggest priorities that we as TDs should focus on in supporting young people and students with disabilities or additional needs as they return to education.
August, Deputy.
In writing.
Let me just deal very, very quickly with the under
No, I'm going to
65.
ask both of you to reply in writing. I'm sorry, I just have to...
Could you give us a sense of the types of legislations and policies that we need to give immediate effect to the convention as well? In writing would be great. Thank you.
Get answers to both of those, but in writing, please, because I have to try and bring in all the speakers. Thanks very much. The next speaker